Okay. So as I said, this is our data in industry arc. Today's focus is on the healthcare industry. So we'll be focusing on things like um, real-time data for patient care and EHR and different things like that. Okay, so as standard across all of our data and industry presentations, we're going to have an intro. We're going to go through some history, look at who's who, like who are the players in the marketplace, what current adoption looks like or could look like for different size organizations, and then what's next. And then we'll open it up to group discussion. Okay, so intro. The healthcare space is very specific in its use cases around data. So the healthcare space relies on quality, timely data to better serve patients, both through diagnosis and speed to recovery. This is heavily dependent on EHR, electronic health records, which monitors all aspects of a patient across visits and occasionally across providers. Having access to this basic information electronically has elevated the quality of care drastically over the last decade. Beyond that, analytics and data science paired with cutting edge infrastructure is bringing about a renaissance of how healthcare is administered. So ultimately, the healthcare space has gone through an enormous digitization movement over the last decade plus. And we'll talk about a variety of different policies that have been put in place to promote digitization within the healthcare space. But one of the things that this space has been able to do that other industries have not, because of that migration to digitization and that big push across the industry as a whole, is wide-scale integration across providers, and specifically going from the 0 to 1 factor much more rapidly than other industries have. So going from the not knowing to knowing something. So even just being able to count the number of patients that they have or count the number of visits an individual patient has had at a given facility. All of these things are now possible within the healthcare sector. And so because they are at that base level of being able of knowing what their data is, there's the ability to then elevate to true analytics and doing creating action within data, as opposed to a lot of different organizations that are still working on that movement from not knowing to knowing one thing. So being able to count things or being able to sum their finances, things like that. Okay, so for the history, we're going to start way back and then we're going to jump a ton of time forward. So one of the big pieces of history that comes up when you talk about data in the healthcare space is this 1847 study. Ignaz Semmelweis he was a lawyer who then decided to go into medicine. He went into obstetrics, and this was largely a midwifery industry at the time, and so gynecologists who were truly doctors were very rare, and different hospitals were promoting these new departments that were solely doctor driven, not midwife driven. And he started to notice that, particularly as doctors were required to do autopsies as well as treatments, the maternal mortality rate with the doctors was astronomically higher than with the midwives. And so he did this analytical study of what was happening. What did each of those individuals do throughout their day? What were their different tasks? What types of individuals did they treat? And it turns out, best way to fight infection is wash your hands. And so this is really where the outset of doctors and the public in general washing their hands to stop the spread of disease. And so that's kind of where analytics and data within the healthcare space launched. So I want to jump way forward now because there's so much history in healthcare data that we're only going to focus on a couple things. So in 2009, as part of the efforts to spurn the recession and other impacts of the housing crisis, the High Tech Act was passed, and so this was an effort to increase the amount of healthcare IT that was being used across the industry. This used carrot and stick. So there was a lot of funding opportunities, training opportunities, availability for grants and fellowships for people who were focusing on digitization in the space, organizations who were implementing digitization at their organization. But there were also penalties to individuals who or organizations that did not focus on creating electronic health records, moving to a digital space from what was mostly a paper-based system. Oh, this is not 1994. I apologize. In 2011, IBM Watson Health made another giant step forward in healthcare analytics. So now the company is known as Meritive, but it announced its first healthcare partnership and major effort in 2011 with Nuance Communications. This was an effort to increase the diagnosis capabilities of doctors through their through the data that was being collected. And so as we've seen over time now, the ability to use predictive analytics and structured data analytics to not just support, but to truly revolutionize how diagnoses are made has been instrumental from the IBM Watson project. And then finally, just a touch on 2022 particularly, so starting in 2020, but really moving through 2022, COVID-19 efforts spur additional investment in public health data collection, analytics, and application. So here's where we start seeing organizations like the CDC really invest in their data infrastructure because of the gap that they saw responding to a public health crisis. So as they continued to better understand how little data and how little information that they had and how much that was needed to truly respond effectively to a giant public health crisis like COVID-19, they expanded their infrastructure. And not only the CDC, but other governmental institutions, other nonprofit institutions. I think one of the kind of trendy data analytics pieces during COVID-19 was the Johns Hopkins dashboard that allowed you to drill into your county and identify different trends and patterns across the country and across the world of different COVID-19 cases and analytics. And so having seen that and understanding just how powerful well done analytics could be, we've seen the desire for and the capabilities of those data functionalities within different organizations grow drastically over just the past few years. And here I have a quote from the CDC. It's been shortened because it was a pretty long quote, but the gist of this is that they are extremely transparent on the fact that they did not have the capabilities through data to effectively respond immediately to the COVID-19 crisis, and because of that have been building their capabilities through data, through infrastructure, through technology implementation to make sure that doesn't happen again. Okay, who's who? So CDC, we've talked about them already a little bit. They're federal regulatory organization, a big supporter of data implementation across healthcare organizations. Um, Epic Systems. Epic Systems is an electronic health records solution. It's kind of the industry standard for implementation of large enterprise style electronic health records. So think of like Mount Sinai, for example, huge national health organization. It's not only patient focused, it's also a research institution and a university that maintains large spans and swaths of data. They use Epic Systems. United Health Group, they're a healthcare analytics solution platform. So United Health Group, they focus less on what we'll get to next, which is predictive, but focusing specifically around demographics, analytics, operational efficiencies, how to function differently as a healthcare organization. And then finally, Merative, which we talked about in the last slide, used to be IBM Watson, but has since spun off into its own organization. And that's where you start to see things like healthcare predictive analytics. So because this person had this symptom, we expect them to have this additional symptom in 24 hours, or we expect them to need X, Y, and Z equipment in the next 10 minutes, something like that. And these healthcare predictive analytics particularly is where you start to get into real-time data needs, which I think we all know real-time data is not actually real-time data. All we can really say is near real-time data, because there is that, the lag that goes from transforming the data, migrating it between systems, etc. But healthcare truly is one of the industries in which near real-time data can be the difference between life and death. And that's where these predictive analytics really get into that near real-time data. Okay, so adoption. Digitization, like I talked about, healthcare records has had support from the federal government for over 10 years, allowing the industry to more easily modernize their legacy systems, which are often driven by physical paperwork. Due to this high focus on digitization, many healthcare organizations are in a better place than other industries to use that data in productive ways. Security, which is something we haven't talked about yet, though, is a huge factor when it comes to healthcare, particularly PHI, personal healthcare information. And concerns over PHI can be big blockers to actually moving forward on analytics projects and data infrastructure. So this security and data governance as a whole needs to be key to increasing data capabilities within organizations. So I have a couple like specific categories of data implementation that are in use by organizations now. Whether they're in use by a lot of organizations or a few organizations is really dependent on the size of the organization and the intensity of the function. So EHR, used very broadly across healthcare organizations. I would say, as a data professional, I do not like to say 100%, but I would say 99.9% of healthcare organizations that maintain patient records have EHR. Security, this is a huge concern for healthcare organizations. In the past, it has also been a huge issue. There have been hacks into healthcare organizations where people have gotten a hold of individuals' healthcare data and has been detrimental to some people. Invalid healthcare insurance requests, particularly, have been rampant in the last few years as security has become more of a concern. Data governance, this is, from what I've seen, this is less prevalent across healthcare organizations, but is desired. So from what I've seen from different organizations I've worked with, they are interested and excited about doing data governance, but because it's not one of those kind of like big sexy data things, it doesn't get the kind of excitement from funders within the organization that real-time predictive analytics does. So the funders and business users, they want to see outcomes, and governance isn't really an outcome. It's more a supporting role. So then real-time predictive analytics, we've talked about this. This can become applications that doctors and providers can have on their tablet, where they get a notification immediately if a patient has X, Y, and Z symptom, because the combination of X, Y, and Z symptom in past patients has caused high spikes in blood pressure within the next 5 minutes. So that kind of real-time predictive analytics is starting to gain some momentum. Payer, provider, and patient integration. This is the kind of thing where, like, you go to one of your doctors and they have all of your records from your other doctor. You've signed off on it. And you don't have to fill in every single form every time you go to the doctor's office anymore, because there is that integration across healthcare providing organizations, but also the payers, the patients. You can log into your healthcare portal now to see lab results, etc. So all of this digitization has allowed for greater integration, greater transparency, and greater communication across those three really big players within the healthcare space. And then finally, something that is less focused on, but particularly within the healthcare space needs to be a big concern, is data destruction. So data destruction is the idea that across the data lifecycle, there is a point in time in which data not only is no longer useful, it is dangerous to keep. And so, or it's illegal to keep. So for example, I know within the healthcare space, if a patient requests that an organization wipe their records and they don't want to be a patient anymore, they don't want their data there, the organization has to clear their records of that patient. So that becomes an issue when you have multiple different systems that patients in. They may have 5 different applications that they use for different things like scheduling, EHR, insurance contacts. So data destruction is something that we're seeing to start growing the momentum. I work at a company called CTI Data, and it's a boutique consulting firm. So we work across the different industries to implement usually end-to-end solutions for different companies.
Okay.
Okay, so then quickly just to touch on what's next, and then we can get into discussion. So first of all, highly personalized healthcare. What we're doing with all of this data is the same thing that your subscription wine box is doing, or that the closed subscription box that you get. It's highly personalizing your healthcare. It's allowing you to not necessarily become a piece of the demographic, but an individual for your providers. Systems integration, like I just mentioned, across different providers, between patients and providers. These integrations are just going to continue growing to allow for greater insight into your health. And then finally, comprehensive data lifecycle. I mentioned data destruction in the last slide. The data lifecycle overall, though, is where you start to get into full data governance, where you start to understand and not just understand, but standardize at the outside of an application. So at the integration and implementation of an application at an organization. Okay, this data has X, Y, and Z policies. It's standardizing around the different definitions that we already have. We're not going to be building new definitions with differently named metrics because we want all of this to work cohesively as a structure. And then as you go through things like application archive, what happens to that data, data destruction, what happens throughout that data's life cycle. And we'll see that become a trend, particularly in larger organizations throughout the next few years. Okay, so now I want to hear from you guys. I just talked for a really long time. So yeah, what do you guys think?
I was writing down. Sorry, go ahead, Landon. Is it?
Yeah. No. Go ahead, Robert.
I was writing down, Amanda, the key points from your speech. What I would get from it is three big things. Healthcare is unusually digitized, protected, and able to benefit from predictive analytics. Is that fair?
Absolutely. You know, the fact that there has been federal requirements for digitization has put the entire industry above and beyond what, you know, like agriculture or even e-commerce that truly lives online, and above what any other industry has as far as the capability to drive predictive analytics.
I feel like one difference is for the online retailers, as you mentioned, you've got that data, but there's no, or at least less regulation requiring you to sort through it. In healthcare, you almost don't have a choice to look through your data.
Exactly. Right. There's so much auditing. There's so many requirements about, you know, maintaining security of those different types of data that you're required to have. You know, it's rare to see large healthcare organizations not have a chief data officer anymore. You have entire departments that are not your IT department; they are your data department, and you don't necessarily see that in all organizations, although that's shifting for sure. It's definitely, because of the regulation, almost a requirement at healthcare.
Yeah. And you had a point before I interrupted you.
No, it's all good. For some reason, my one screen is flashing, so I'm looking at everybody, but I had to pull the actual screen over to the others, or the view to the other screen. Obviously, I'm very, very, very new to this field, but I was surprised that it seems like data would have been in healthcare sooner, just because it does seem like such a perfect matchup to be able to have, like you said, just everyone's forms digitally as opposed to in paper. Or I knew exactly what tracker you were talking about during the peak of COVID, because it was a very useful tool, it was a very interesting tool, and it seems like the perfect opportunity for a data group to really showcase how powerful a tool like that could be. So I thought that was interesting.
Yeah, for sure. I have some thoughts on that, but Robert, as someone in the industry, what do you think about that?
To Landon's point, why is it not yet automated? Why are we still developing all this now? Why did it take so long? It was a bit of a running joke decades ago that you had to fill out your doctor forms at every doctor. I don't know if you guys remember that, but Like, how long did it take us? And then we were forced to do it.
Yeah, and the reasoning that I've heard from different organizations is security. Everything was on paper because if it was on paper, you couldn't hack it. You would have to literally break into someone's office, pull out a bunch of forms, and then have to read through all of those forms. So no one's actually going to do that. Ultimately, eventually, I think that became an excuse. It seems like a good sentiment, but to a certain extent, I don't know how much of that was driven by valid security concerns and lack of understanding of what that security needs to be to truly be digitized. So, and then I think like even healthcare is such a researched field. There are so many, research papers that you can find on every single niche topic of healthcare that are driven on data sets. However, the majority of the time, those data sets are not available. They're not made public because those are protected. They're PHI. If they're not PHI, then they still are owned by a specific institute who's not going to share that data set online. And so even those like highly researched areas of data, you can read about them. You can read the outcomes of the research on it, but those data sets just aren't available.
When I was, so I've been working in health data for 10 years now. And when I first started out, I remember an interview where they said, would you rather work in health or pension? And I was like, well, I don't care. Just put me where you need me. And I was so lucky that they put me in health. I can't think of, like, it's one of the most dynamic industries that's out there. And there's so many opportunities. I think the only other industry that really jumps to mind is advertising, with the amount of raw data that there's potential for. But they're not being forced to look at it from regulators the way that we are.
Yeah, absolutely. I think there's this concept in data of like needle in a haystack. You're collecting so many mountains of data that ultimately it becomes too overwhelming to analyze it unless you're forced to. If you have one data analyst on staff who is, instead of having databases available, although e-commerce would have databases, but like imagine one data analyst going through spreadsheets and spreadsheets and spreadsheets, attempting to understand the e-commerce data and define the consumer life cycle from that. It's just not going to happen because consumer life cycles are different in different at different e-commerce solutions. Their customers want different things. Whereas in healthcare, not only is it more standardized across organizations, I think, like if you think of the patient life cycle, your patient wants the same thing. Your patient is coming into your organization either as preventative or immediate care. They want to get better, or they want a solution to whatever their preventative care question is. And then they cycle through. Do they, do you see an individual cycle through the ER constantly because they don't have insurance? Or do you see someone cycle through on their annual checkups? Do you see someone start to cycle through because they're going through fertility treatments and then they get pregnant and they're going through all of their pregnancy treatments and checkups? These are very standard patient life cycles that give a baseline, I think, for healthcare analysts to start at, where it's not so overwhelming to say, like, okay, now that we have all of this data, let's consolidate it down to this one thing that predicts the next time this person who has diabetes and doesn't have healthcare is going to show up in the ER.
Yeah, I think kind of what you were saying led me, maybe this is what you were saying. I'm doing my best to follow, but like being able to track people's health patterns, I feel like that kind of brings us to a bit of a slippery slope. And I think I've heard similar notions when people started really getting big into like the DNA kits and testing for possible health issues that they might have far down the road and how that could affect their insurances and stuff like that. I wonder if this tracking of possible future cycles or whatever, while it could be very helpful, could absolutely, obviously, everything can be used for negative, but it's just reminding me of that.
Yeah, and that's a really interesting piece. Like, how does this impact? We know that the healthcare industry is a for-profit industry. And so the healthcare industry, while looking to do good, there is also the underlying understanding of continually making a profit. And so where do we cross that line of these analytics are helping our patients versus these analytics are helping our organization and not necessarily helping our patients or potentially harming our patients?
Tricky balancing act, huh?
Yeah, because that diabetes patient who is always in the ER because they don't have insurance. When
sorry,
go ahead.
I don't know how familiar you are with insurance rate pricing, but if you're trying to price an auto policy or a renter's insurance policy, you have a lot of leeway for what you can build into your model. Maybe you could build in someone's DNA test, but for healthcare, you can't. There's only a couple things you actually can use. So they kind of already cut off the ability to do that. I'm not saying they can't build it in other ways, but they can't price on it.
That's interesting. I didn't know that.
I think it's gender, age, and location, but don't quote me on that. Or put it all over YouTube.
It will be on our YouTube, but we don't get that many. We don't have many subscribers, so
Yeah.
We won't like make a remix of just that quote and then twist it or anything.
Whatever the
with a bunch of
legislation is
cats in the
currently,
background.
Yeah.
it is restricted for healthcare.
Yeah. Yeah, that's interesting because then you do get into those, I think, moral arguments and understandings of like, as a society, particularly as like a government, as you have more access to these analytics and you start to understand where the majority of funded healthcare costs are going versus private healthcare costs. So individuals paying their insurance and receiving insurance payouts when they go versus individuals who are funded by federal dollars because they don't have insurance, but they are using the ER. As a government, are there points at which you have to consider strain on societal good?
Madison, I wonder what your background is in. I wonder if you work in industry, or if you're a student, or if you're just starting out.
Actually, I'm working, so I'm an accountant. So the data analysis, actually, I don't know that things. So this is new to me. I'm just happen to just got this page. So for my industry, we use a lot of automations actually. So we have IT department people, so they just maintain our system. If our like Windows or maybe the software crashed, and then so they can fix these softwares for us. But we also have some data analytics. Actually, they are called the financial analytics. So I think they just might type in some code and then just make the I don't know how they are doing, but I thought like it's similar to this one. And so they just they just and they I guess maybe just get some generate report from our software, and then it generated, and then so when we go to work, and then the reports are ready to use, so it kind of save our efforts and the time. So I don't know if it's related to the data analysis. So actually, I mean, I don't know about this data analysis things. So um, and I have accounting background, finance background, and a little bit statistic background. So I don't know if it's can related to healthcare actually. So
Yeah, I mean, one of the things I like to say, you clearly have the right background for an analyst. One of the things I like to say about data analytics is it's industry agnostic. And that's kind of what this arc is about, is we're seeing how data looks in all of these different industries. And it sounds like your company is doing really great automation, even just at a base level of making sure that you have your reports instead of having to go run your reports and load them yourself. So, I mean, yeah, that's definitely like engineering. And then as you go and review and enter those reports, that gets into the analysis and financial accounting, etc.
yeah, yeah.
So what's everyone's thoughts on like the what's next trends?
We have so many what's next set up that it's a very dynamic landscape. You've got changes in regulation, you've got changes in line of business, you've got changes in software, and it's a constant balancing act between meeting the needs of those three changes.
Yeah, actually, as someone in industry, there are so many healthcare applications like software that you have the potential to be using. How do you find that there is some standardization? How do you do integrations internally? Are you finding that those are really siloed data solutions?
Those are discussions that are always going on. And I don't think there's a clear answer. Like, suppose you found a new system and it works fairly well, and it cost you X dollars and Y hours to set it up. And then there's a new system that comes along next year and it's a slight bit better. Do you want to switch?
Right. What's your cost of investment versus your potential opportunity cost of not going with the new solution? Yeah, that's really interesting, particularly with how fast health IT grows.
And I wonder how that stacks up to other industries, because I've worked in healthcare for almost my entire career. I don't really know how it works in, say, automotives. I don't know how dynamic that is.
Yeah, I think, and we'll get into that throughout the arc because I don't know that either. One of the reasons we do this is so that this forces me to go dive deep into healthcare and understand the data landscape a little bit better. So I think those are questions that we can answer as a group as we continue to do these.
To an extent, it's got to hit everything, because you said data is agnostic to industry. Like, everyone was doing it on paper 40 years ago, and everyone had to adapt to email and spreadsheets 30 years ago. And everybody has the possibility for predictive analytics this year.
Yeah, and I think what I'm really interested in is the depth and breadth of applications, like the span and diversity of applications that are available in different industries. So like if you think of like supply chain management, I don't see that having 40 different potential applications you could use to do like international supply chain management. It's a very like niche thing, I think, similarly to like industrial manufacturing. I'm sure there are like specific operational applications that are for automotive manufacturing versus like low-end clothing manufacturing and different things like that. But is there a swath of options, or are you kind of pigeonholed into a single option? And does that lack of competition impact the quality of the applications and data that you're collecting?
That's a good point. Certain tools we use like R Studio or Desktop BI, they're worldwide. Everyone can petition for improvements. And certain tools that you use are specific to your industry, particularly your state. So how many options are there really in New York? New York's rules are a little special.
Right.
Yeah, I guess like on that note, for like what departments have hands in different things, like I have some background in like the medical marijuana industry, and just seeing like, I guess the amount of digitization internally for an organization, but then what levels required by like New York State Health Department of like them coming in and like what, I guess, like points they need to monitor and things that like outputs that they need, that you can't really like forego that unless you want to like close down.
Yeah. And then if you want to partner with the New Jersey provider or the Connecticut provider, they don't have that report for you. So what are you going to do?
Yeah, that's all really interesting. Okay, so it's 7:50. We're coming to the end of the session. Does any other thoughts, points of discussion, things that people want to poke other people's brains about?
I have a list of about 50 very interesting healthcare topics I've been compiling over the past 10 years, and I wish I had one ready here.
Well, we are always available. I'm gonna put in the chat. I think Ashley, you already put our group LinkedIn in the chat.
Yeah,
So
I'll throw my personal in too.
Yeah, I'm gonna put my personal in. So feel free to reach out to either the group or either one of our personal LinkedIns if you have additional questions. We're always taking requests for topics, speakers, anything. So if you have something you're interested in, please reach out, let us know. And a couple announcements. First one, I think Ashley put in the chat here. There are two health-related Kaggle competitions going on right now. So for those of you who don't know, Kaggle is an open data set site where different, different users and industries, people will upload free data sets. They also do competitions. So like if you win a competition, you get a badge and you can put it on your resume and different stuff like that. And so like those competitions are really fun. Ashley also just put in the chat, so we're both in Syracuse, and Syracuse is doing a data challenge right now, and so that goes on through March 31st. If you're interested, you can go and write a little data application. I think actually I'll put an example of one that the old CDO of the city of Syracuse put up the other day. So here is an example of like what one of the outputs of that data challenge would be. And then finally, we will be having another session. Actually, when is that going to be?
Sorry, blabbing without unmuting. April 11th, 7 to 8 p.m. It's another Tuesday session, but that'll just be on like the finance industry.
Yeah, so so that's kind of everything. Any final questions or thoughts before we wrap up?
If you know of anyone looking to begin work as a health data analyst, let me know.
We
I'm
will
happy to talk about what it is.
Yeah, and actually, if you ping me on LinkedIn when you get the ad up, I will put it on our Salt City Data Community LinkedIn, so
Cool.
we can send that around to the group.
All right, we'll do. We're a local group, by the way. We're not hiring anyone from, it's not a remote position. It's an on-site where you're actually with the team every day.
Okay, cool. We will make sure that that's clear, because there are so many positions. Like both Ashley and I are fully remote. There's so many data positions that are remote now. But it's good to have that on-site team as well.
I feel like it's nice how it's self-selecting, because we all have the option to work from home, but we don't. We kind of want to see each other and work together in person, and that's part of why we work there. If you wanted to work remotely, there's plenty of companies you could have gone to work remotely, but we like being in the same room with each other.
Absolutely.
It's kind of sorting itself out. I think you're going to get some companies that work on site and some companies that don't.
Definitely. Yeah. Okay, cool. Well, thank you, everyone. We hope to see you at our next event. Keep an eye on Meetup and our LinkedIn, and have a great night.
Thanks, everyone.
Bye. Thank you for the presentation.